done this for your office, and so I'm excited for the opportunity, and even more excited to see how many students are back there, even though I can't see their faces. I'm glad you're here with us. And the face I can see though is Damien. Damien's our staff member with athletic training. Oh, and hi Morgan. Thanks for showing your face. It's always nice to not feel like I'm talking to myself, but I'm also happy to talk to myself. Like I was saying, Damien is our staff member, so if you email our AT info page, you might get him or you might get me. This was also a great opportunity for me to update some of the pictures in my slides. So I spent some time last week putting some new pictures in here. This first picture is a new old picture. It's a new picture for the slideshow, but it's my favorite old picture of me. That was me back UCF softball, probably the very first team that we ever had for softball at UCF. So that would have been maybe 2000. Well, I know what year it would have been. It would have been 2002 because I have a who's now a 23-year-old son in my belly in that picture. So that's me working UCF softball. I worked Division I athletic training for most of my career before I kind of went over to the academic side. So without further ado, that's me. I'm Kristen Shellhace, and let's see if I can make my slides change. Why aren't they changing? There we go. All right, so what I'm going to do today is talk to you mostly just about the profession. I'm not here to hard sell anybody. I know you guys have a pretty wide variety of majors. This is probably one of the more diverse groups that I get to speak to. And so you might just have an interest in health and not quite certain what athletic training is. So I'll spend the majority of the time just talking about the profession and why I love it and why it's awesome. And then I will spend some time talking about the program as well. But for the most part, I'm just going to kind of talk to you about career choices. And then you can also ask me some questions. I know there's question and answer time at the end, but also I'm pretty informal. If you have a question that you kind of want to know right then and there, just unmute and holler or put it in the chat or something like that. So athletic trainers is kind of a either misunderstood or poorly understood profession. We are a health care provider, so we don't want to be confused with personal trainers, although they are also awesome. We are healthcare providers. We are licensed as healthcare providers under the Department of Health. And what we do is we work with physically active individuals. You could probably tell from the title of the presentation, it's not always just sports, but that's what most people think of. They think of NFL, somebody runs out on the field to see what's going on. That's an athletic trainer. We work in high schools and colleges, and that's where people know us the best. But we also work with military, fire, police academies. We work with dancers. We work with NASCAR racers. We work with Walgreens industrial plant people. So basically anybody who's physically active, and we provide preventive care, emergency care, diagnosis, intervention, of all kinds of things. We're also not just ortho. A lot of people think of us as mostly ACL tears and sprains and strains, or they might think of us as concussion people, and that's all true. But our students are also trained for general medical stuff like dermatology, upper respiratory, ear infections, internal stuff. I've got athletic trainers who work in physician practice with surgeons. And so we're kind of all over the place. I describe our profession as kind of a mile wide and more than an inch deep, but we're very wide. Our scope of practice is huge. We do lots of things, and our patient population is middle school to middle age, physically active, healthy people, except for what's happening to them right now. So people also confuse us with PT, and I kind of describe that as the inverse. PT has a scope of practice that's fairly narrow. They do rehab. They're really great at rehab. And their patient population is huge. Little babies, old people, somebody with a burn, somebody who's got a diagnosis of, whatever. They're all over the place with their patients, and they have a fairly narrow scope of practice. We have a fairly narrow group of patients and a really wide scope of practice. So that's kind of the best way to describe it. Like I said, people think of college or pro sports usually, or high school sports. They think of NFL. This actually is one of our alumni here. They think of us giving out water, which is true, but also in Florida, that's life or death. Hydration and heat illness in Florida is no joke. We lose way too many especially high school football players every single year due to heat and hydration issues. So this is Waterboy the movie, and he's not being an athletic trainer there, but that movie was filmed here. So there's your fun fact for the day. It was filmed on our campus. And we also do a lot more than taping ankles. So here's all the things, like I said, super wide scope of practice. We're probably one of the, well, not the only, but we're one of few healthcare providers who get to do prevention. If you think about physicians or PAs or in PTs, most people get to know their patients once they're already hurt, right? So we're kind of one of the few healthcare providers that knows their patients before their patients, especially in the high school, college, and pro setting. If they come in as a freshman, you might know them for a whole year before they ever even have a problem. You know them, you know their family, you know kind of how they operate. So we do a lot of prevention stuff, whether that's like ACL prevention programs and things like that to prevent ortho injuries. We also do pre-participation exams. We are the people who call the game for lightning to keep everybody safe. A lot of hydration and nutrition type stuff. And so it's kind of fun to get to know our patients before they're hurt. Then you really get to know them very well throughout their whole time. We do a lot of ortho, like I said, that is primarily what we see, but we're also seeing a lot of non-ortho. Think about wrestlers with skin conditions. Somebody has got to check that out and make sure if they can wrestle or not. If we have a patient who's complaining of ear pain, they know how to look in there and see, is this something that needs a doctor or is this something that probably doesn't need a doctor? And, do we need to refer or not refer? Critical incident management. I was telling the host earlier that probably Damar Hamlin did more to help the public understand what athletic trainers do in that one incident on the field. When was that now? 3 years ago? Something like that. That those were athletic trainers who respond. If you see somebody being revived on the field, more than likely it's an athletic trainer who's doing that. So we train our students for everything from CPR, spinal injury, multiple casualty situations, which is kind of a sad statement on the world we're living in. When I was in school, we were not trained for multiple casualty situations, but now the reality is when that stuff happens in America, it happens at the Boston Marathon, where the athletic trainers are. It happens on the field of a high school. It happens in a gym, right? And so it's high schools and it's sporting events. So we are trained for that. So they do a lot that you wouldn't necessarily think of. We also do a lot of rehab, and so that's why we look a bit like a PT does. And we refer when needed, but we can handle that ACL rehab all by ourselves as well. And then with every healthcare profession, you have a lot of, paperwork, professional responsibility, record keeping, and that kind of stuff. So, athletic trainers are also involved in research. Some of them are also, high-level researchers, but a lot of them might be in practice and they're kind of the clinical practitioner who's feeding the data to the researchers, right? So all this research helps keep people safe. This is why football players wear helmets now, and they didn't, back in the day. It's because somebody said, hey, we could prevent concussions. This is all the research on, do mouth guards actually help concussions or not? So lots of research goes into keeping people safe, and it's athletic trainers and team physicians who are kind of leading that charge. You can see some of the different topics here, and this is just a drop in the bucket. Here's what I like to kind of enlighten people about. Again, lots of people have heard of us in a high school, college, or pro, but we really do have athletic trainers working everywhere. So performing arts, we have alumni who have worked, multiple alumni who work for Cirque du Soleil. We've had one on the Hamilton show. I was so jealous. She was traveling with the Hamilton Broadway show. We've had Lion King athletic trainers. Obviously, we're at Disney World. I've got lots of alumni who work down at Disney with the parade and people and the performers down at Disney. We even have one alumni who meets the cruise ships in Puerto Rico on, I forget what day of the week they come into Puerto Rico, and she meets all the dancers and performing artists from the cruise ship and helps them with what their injuries are, and then sends them with a plan and they go back out on the cruise ship, right? So that's an athletic trainer. We are increasingly in fire academies, police academies, and places like that where, again, super physically active. You've got somebody who's going up and down ladders into burning buildings. How is that not as active as any, high school football player? It's more, right? So they have figured out that if you have an athletic trainer on staff, you can prevent injuries from happening. You can make sure that you're not, if somebody does get injured, you're not dealing with the workers' comp system and having them gone for a half a day because they need to go out to some clinic somewhere. Everything's just handled in-house. And so they're saving lots of money for public safety people. Same thing with the military. Military has figured out that we're saving them tons of money because, it's $500,000 or something like that they put into like a Navy SEAL recruit. And if you lose that person because of a stress fracture that could have been prevented, it's kind of crazy, right? So lots of athletic trainers working with military. They're not typically in the military, but they are typically civilian contractors who are working with boot camp or SEALs training and things like that. Up here in the occupational health one, any kind of a occupation where there's lots of heavy lifting, like Amazon has dozens and dozens of athletic trainers. I know there's one at like Ski Nautique has an athletic trainer. The Frito-Lay plant down in Orlando has an athletic trainer. Boeing, flight attendant training academies, places like that. Anything that you can think of where super active, potential for injury, they're hiring athletic trainers in-house to try to prevent injuries and then also to manage them when they do happen. And then that last picture there, we've got athletic trainers who work in hospitals, outpatient rehab. So in outpatient rehab, they look an awful lot like a PT because they're just doing rehab and not some of the other stuff that we talked about. I've also got some alumni who work in physician practice with surgeons, so they look a lot like a PA. They'll meet the patient in the waiting room and bring them in and show them all their MRIs and whatever came back. They'll do the special testing, and then the doctor pops their head in and they say, I think an ACL's torn here. And so they look a lot like a PA. So we're kind of all over the place. And I would say the vast majority of people don't have any idea that that's what we're doing. So what makes an athletic trainer great? They get to help people and solve problems. It's definitely a thinking kind of profession. And although we are technically and legally overseen by a physician, that's part of our practice act is that we're overseen by a physician, but most of the time that physician is not there. So it's a lot of autonomous stuff. If you are at a high school or college or a pro team and you're dealing with an injury, usually you're calling a physician who's somewhere else to tell them what you think it is versus kind of being told by a physician what to do. So if you like autonomy and you kind of don't want to be, under somebody's thumb all day, it's a great profession for you. Lots of athletic trainers, again, depending on the practice setting, you never see the same day twice. So you might be taking somebody to a surgery and sitting in on the surgery and getting them back to their dorm room one day. And the next day you might have practice all day, and the next day you're on the road, or whatever it is. It just really depends on your practice setting. But it's not a day where it's kind of a 9 to 5. Everything is always the same, which for me is great. For other people, it's not. But I get real bored real fast, so I like to have that diversity in my day. Lots of the jobs, not all, but lots of them offer intensity and excitement if that's something that you're looking for. And then the profession is growing and diversifying, like I said. This was fun to update these pictures. This one on the left here is an old picture that I've had in the slideshow for a long time. That's Matt B. He was traveling with the Michael Jackson Cirque du Soleil show. So this is probably a 15-year-old picture. But he was traveling for an entire year with that Cirque show. And doing an amazing job. And I got to see the show. I was so jealous. Very cool. But then I added this one over here because that's the same guy. He ended up leaving Cirque du Soleil and now he's in Major League Baseball. So, not only diversifying as a profession, but as an individual, you can kind of cross different areas and do different things. He started out in college football, went to performing arts, and now he's in Major League Baseball. So that's pretty unique. Not everybody is that diverse, but he just kind of gives a good example of, that you can change your path as well. Who makes a great athletic trainer? So hardworking and independent. Like I said, lots of times you're the only one, or maybe a partnership of 2 or 3 people, and you're not necessarily having somebody overseeing you all the time. You have to have access to a physician that you can call. But lots of times you're kind of giving them the scoop and then they're saying, okay, I'll order an MRI or whatever it is. So you got to have really good clinical reasoning skills because most of the time you're the only one and you need to be able to kind of figure out, is this an emergency? Is this an urgent thing? Is this a non-urgent thing? Does this require a referral, or can I handle it myself? We communicate with lots of diverse people, and so that's diversity in what people typically think, like race and gender, but it's also it's really more diversity of you have to be able to talk to a ninth grader who's freaking out on the field because he thinks he's broken his leg. And then you have to turn around and talk to their mother who just ran out and is freaking out. And then you have to call a physician and you have to talk medical to the physician. And so you're kind of having three different levels of communication all in the same scenario. And you've got to be able to do all of that. So good communication is super important. And if you speak another language, that's also great, especially if you want to do pro soccer. They love it when you can also speak another language, but we speak many languages even when they're all English. And then you have to be working effectively in intense conditions. And that's the one that maybe sometimes scares people, but just also know that depending on where you work, you can have more or less intensity. If you're outpatient rehab and you're kind of seeing patients 9 to 5 and it's air conditioned and there's no game going on, well, it's probably not going to be all that intense. But if you want the intensity, you could also be spine boarding somebody on a trapeze net during the middle of a Cirque du Soleil show. So you can kind of choose your level of intense conditions. These pictures, the guy on the left is at Dartmouth. He's the head athletic trainer at Dartmouth. He's one of our alumni. And then the picture on the right is our students last year who were being trained to handle respiratory and cardiac arrest. So to become an athletic trainer, you need a degree from a program that's accredited. So all of the programs are at the graduate level. They're all master's degrees. So that's different than somebody 10 years ago who entered the profession. You could have done it as a bachelor's, but now it's all master's degree programs. So you would have an undergraduate major of your choice. You could be any major. It doesn't necessarily matter which one, but it usually makes sense to pick something that makes sense, that has prereqs included. So most of the students that we see applying are either kinesiology or health sciences, exercise science, or something like that. But you can be any major as long as you get the prereqs that you need. So once you finish the 2-year degree, then you pass the BOC exam, which is a national examination, and then you apply for your state licensure. So that's kind of how you become an athletic trainer. So it's 4-year degree plus a 2-year degree in most cases to be an athletic trainer. Job outlook is great. And if you've listened to anybody else speak in these things, anybody who's a healthcare provider is telling you the job outlook is great. Everybody needs healthcare providers. It's growing and growing. So any health career that you pick is probably going to say this. I can dive a little bit into what kinds of jobs, the ones that are growing the most in athletic training are those emerging practices that I talked about. So if you think about it, even though high school, college, and pro is about 50% of athletic trainers, so it's a sizable percentage. And there's some growth in those areas because maybe you get a new high school or maybe the university wants an extra athletic trainer or whatever. But for the most part, like the universities that exist already exist, right? So the growth is happening because maybe they need more people, but not because we have a lot of new universities. But if you look at the military practice setting, they're just discovering us. So like last year, the Army was hiring 600 athletic trainers. The professional performing arts groups, it's more and more. Public safety, they're just figuring us out. So the rapid growth is probably going to be happening in a lot of those other settings. And it's because, we're proving that we have a really huge return on investment and prevention is important and it saves the company tons of money. So lots and lots of growth everywhere, but mostly in kind of those newer areas. And then salaries are highly dependent, obviously, on what you're doing. They are, 6 figures if the head athletic trainer at, Notre Dame or whatever. I don't know that person. I'm just guessing, but it could also be all the way down to sometimes in athletics, you got to be an intern and be paid in kind of ramen noodles to get your foot in the door. So it's really kind of a wide variety. It surprises people when I tell them that the highest paying salary is typically a secondary school, so high school athletic trainers. And that's because one, they are usually on a teacher's contract. So there's usually kind of an established base salary and an established salary ranking. There's sometimes unions involved where, they're making sure that raises are happening on a regular basis, and that doesn't happen in all settings. And they're usually paid as a teacher, even though they're not teaching in many cases. They're paid as a teacher and they get a stipend on top of that to be the healthcare provider on campus. So if you took a job in Orange County this year as a brand new athletic trainer with no experience, probably we're I have to get my stats updated on this, but I would guess probably 58 as a start point, and then experience after that for a 9-month contract. So usually secondary schools are a little bit more stable and salaries are coming up, and then everybody else just has a huge variety. So I think before I go on, because I was going to talk about the program, I thought I'd just see, do people have questions about athletic training in general? Yeah, Morgan, I love it.
Yeah, so do you think it like if we want to move up maybe more or like faster, whether it's like we want to be like the head athletic trainer or just overall make more money, do you think it would like make sense to like get our athletic training degree and then maybe go back to school to get our like DPT
Mhm.
degree, or does it really not make that much sense?
So it's a complicated question because if you're talking to anybody who's been out of their degree by 10 years, you probably are hearing that lots of people used to do that. Tons of people used to get a bachelor's degree in athletic training and then they go towards PT. And it made a lot of sense then because you're going to get a great education as an athletic trainer. And then you would go on to your DPT. Doesn't make nearly as much sense now because master's degree is where we're already at. So you'll be looking at 4 years of an undergrad, 2 years of a master's, and then 3 years of PT school. And so that doesn't make a ton of sense. We're actually starting to see the reverse. We're seeing people who became PTs and then they talked to the NFL and wanted to work with the NFL, and the NFL is saying a PT degree is not enough because they can't use you if all you can do is rehab. They need you to be able to do emergencies. They need you to be able to do the other stuff. So we're having DPTs ask us about coming back, which is interesting considering how old I am. That's a real shift. The other thing, just be a little bit more nuance about the salary. You're absolutely right that PTs tend to make more. They're reimbursable by insurance companies, and that's going to make their salaries typically higher. But their debt to income ratio is also higher. It's usually $100,000 to get through PT school. Whereas athletic training here, the entire degree is about 26,000 altogether, beginning to end. So that's not per year. So the debt ratio is higher, even though the salary is higher, you're correct. And then just kind of to go back to athletic training, it really does, the salary depends on where you're working. You can absolutely make a very good, fair, reasonable salary. But you can also, walk into a situation where somebody's not treating you fairly and you need to learn to leave. We've actually been benefited of recent by one, the change to the master's degree, but honestly, the pandemic helped our profession a lot. Athletic trainers remained on campus when everybody else was gone. They remained in the hospital when everybody else was gone. And we got a lot of credibility and a lot of people understanding us. And frankly, a lot of older athletic trainers, older than even me, um, left the profession because they weren't being treated properly. And so what happened was companies learned that you have to pay them properly. And so I'm seeing salaries up $10,000, $15,000 from just 3 years ago because high schools are figuring out that you can't make the person teach all day and be the athletic trainer. So they're keeping the salary, but they're dropping the entire teaching requirement. I'm seeing colleges come up by $15,000 because they can't keep their people, or they couldn't during the pandemic. So that actually did us a lot of good. So I'm seeing a lot of change in that area. We also 2020 standards had us teaching our students about advocacy and boundaries. And that has really helped. I definitely get calls from alumni all the time that they got together with the other athletic trainers in the district and they said, we need a raise, and they got a raise. I had never heard of a sign-on bonus in athletic training until 4 years ago. And now it's pretty regular that high schools are offering a $10,000 sign-on bonus. So the world is changing quick. And so if you're talking to somebody who's a little bit older, they may have kind of given a sad face attitude about it. And I would say the world's changing and for the better. So that's awesome. I see a hand, Milo.
Hi, can you hear me?
Yes. What's up?
Hi. So you mentioned something earlier about, especially like if I wanted to, because what I want to do is I want to be on the medical team for like a team in Spain, like a soccer team.
Yeah.
And so, I mean, what's the route that I would take for that is what I'm trying to figure out.
Well, fun stuff for sure. I can
Hmm.
tell you what route some of our alumni have taken.
Okay.
So we've got several who work in Major League Soccer here in the US, and we've had a couple who have worked overseas, including in Spain. And it again, this kind of surprises people. A lot of people have this idea that like maybe you go to a high school and then when you get better, you go to a college, and then when you get better, you go to a pro. But that's not at all how it works. If you want to go pro, you ask for those kinds of clinicals right away when you're in the program. So you'd be asking if you're here at UCF for city soccer or UCF soccer or the Pride or whatever it is, so that you can get some of that experience. And then you
Hmm.
go right into a job with pro sports.
Okay.
And so again, it's one of those things where the salary, if you first get a job with a really great team, they might not be paying you very much because there's 1,000 people who want to do that job. But if you stick around and you become the head, then things get better. And so it's a bit of a mixed bag with regard to salary, but you go right as a student to being a clinical placement, and then you go right as an intern afterwards, and you work your way up. So
Oh,
the two athletic trainers right now for city soccer, well, they have three, but two of them are UCF alumni. And we had somebody who was in Spain. It wasn't the biggest fancy team. I don't know all the names of the teams, but he was out there with one of those teams there too. So probably as far as pro sports, soccer is where most of our alumni are if they're in a pro sport.
okay. No, I was just wondering because I mentioned something that like I'm saying during you said that for a master's degree to get this, correct?
To get athletic training, yes.
Yes, yes. So I'm saying like during that time I could intern at a team local, maybe around here, to get experience for that. And once
Yeah.
I get my degree, I actually apply to one of those jobs.
Yep. Yep.
Okay. All right.
Yep.
Got
And
it.
there's also a misconception too. I think there's a lot of people who I talk to who say, I want to be a PT and I want to be a PT for sports teams. And that is a thing. I'm absolutely not steering anybody away from that, but you just have to understand the reality is the average kind of pro team, let's just take NFL because that's what people know the most. They will have a PT, but they'll have one PT and they'll have six athletic trainers. The soccer team is unlikely to have a PT. They're going to have athletic trainers, so that the market is much greater in pro sports for athletic trainers than it is for PT. So just kind of know about the market. It's not that they can't do a great job. They absolutely do a great job, but um, they need the people who can handle on-field emergencies, and so they're going to have more of those. Does that make sense?
So yeah, I mean the thing is I want to be like on field. Like for example, if a player gets hurt, I want to be the person running out to the field, make sure they're
Yeah.
okay, yada yada, all that stuff.
That's an
So
athletic trainer. Yep.
right.
And if you're
So
in
that's
Europe,
that's my
though,
goal.
if you're in Europe, you're going to be called a physio.
Physio. Right. That's
Physio.
that's
Yeah.
that's the word
Yeah.
that they use for that.
Yeah. They have a whole different kind of a system, but even that's changing. We have only one right now accredited program in another country, and it's in Spain. Isn't that the country that you said you want to work in?
Yeah, yeah.
There's one
Funny enough.
accredited program where you can get a Katie accredited degree in Spain, but there's another one that just got approved in Hong Kong, a second one in Spain, and then we have agreements with Ireland, Canada, and Korea and Japan, I think, where if you're a physio in their country, you can sit for our exam. And if you're an athletic trainer in this country, you can sit for their exam. Does that make sense?
Yeah. Do you
So
happen to
we
know
have
the
we have
name
some
of
agreements
the
that way.
Spain one? Do you happen to know the name of the Spain one or not?
I could get it. Honestly, if you just go on the Katie website, which is it's caate.net, it's on my very last slide. They have a list of all the accredited programs in the whole world, so you should be able to see it there. You may not see the ones that I just said are brand new accredited, but I know another one in Spain and then Hong Kong.
Where could I find the link to that?
the caat.net, there's a button that says find program.
Okay.
And you would just use the little drop down menu to find the program, and then they link directly to the program from there.
So you said CAT.
caate.net.
Okay. All right. Thank you.
Sure. Any other questions about just athletic training in general?
No, that's about it. Thank you, Miss.
Anybody else? Otherwise, I'll go on.
I think you'll probably cover this in the next half of your presentation, but is there a specific requirement on like job shadowing hours or one that you would
Get in?
recommend for
Yep.
the master's
Yep. So I'll
program?
definitely cover that, and then I'll also talk about the hours you'll get if you're in the program. So we'll do that, but it's 50 just to tease the information. All right, so I'll do a little bit about UCF, and you'll probably learn more about the profession too just by hearing about UCF. But we are accredited by the Katie. That's the website that I was just sending Milo to at caate.net is the website. They're the national accreditors for athletic training, and it basically says which programs are doing a good job to make sure that they're putting people out who know what they're doing. You know, you guys probably know what a creditor is. So we are 6 semesters, 2 years. So we go summer, fall, spring, graduate, right? So it's 2 full years, including summers, 65 credits. And it's a lockstep curriculum. So that means that students come in together when they apply together and they get accepted. They would be the class of whatever, 2008, and they take all their classes together through the 6 semesters. So it's different than what you're used to in undergrad, where you're kind of meeting new people in, every class that you have, and your classes are all over the place as far as time. You're with the same students and you're on a block schedule. So our first years are here Monday and Wednesday all day. And our second years are here Tuesday and Thursday all day. And other than that, they're not on campus. They're either at a clinical or they're living their life and doing whatever else they do. So our classes run back to back to back all day, 2 days a week. And so that's what we look like. And we have very experienced faculty and lots of great research opportunities and other kinds of opportunities. And you're seeing on there just some of the clinical sites that we are sending our students to. I think we actually have upwards of 40 clinical sites that students can go to. So these are just some of them, but we do have some unique sites that other places won't have. We've got multiple pro teams, so you see Pride and City, but we also work with the WWE. I don't know if you know, they train and film right down the road at Full Sail area down there. So we have a student who's embedded with the WWE. We work with UCF and all their sports, of course, but we also work with Stetson and Rollins, all of Orange County, which I think is 22 high schools, all of Seminole County. We have a couple out on the coast if we have a student who's living kind of in that direction, a bunch of private schools. So we're kind of all over the place. And then we've got some outpatient rehab and Kennedy Space Center, which is like an industrial setting. So they work with, that's this rehab works down here, Kennedy Space Center. They work with NASA, Blue Horizon, and anybody else who's a company out there on the Space Coast, and they do all in-house injuries and rehab. UCF, we do a great job on our pass rate, so that's that national exam. So our students are passing top 80s to 90% the first try, and if not the first try, usually the second try. Everybody's passing at 100% as far as our 3-year aggregate. And if you look at the national average there, it's about 69%, and so we're well above that. So our students are graduating and passing the exam, and then they're getting jobs, which is that number that you're seeing there at the bottom. Depending on the year, yeah, obviously things can be different, but I'd say right now it's about maybe a third college and pro and a third high school, and then a third kind of some of these emerging areas is what our graduates tend to look at, but they're all over the place. So you would get a degree if you're at UCF, which I assume you are, probably kinesiology or health sciences, but you can do any degree as long as you get the prereqs, which I'll talk about on the next slide. You have to have a 3.0 overall GPA, and 50 hours of observation, which was your question there, Morgan. And we do want you to do the observe in a very traditional setting. So that's high school, college, or pro. And that's mostly just that we want the student to understand what they're getting into. If we allowed students to do 50 hours, let's say an outpatient rehab, they would be very surprised at football camp. So we just want to make sure they've been in an atmosphere that's got it's hot out, it's maybe early, there's a coach who's yelling, and get a better idea of kind of what the profession could look like, even though not everybody ends up in that setting. So it's more just to make sure you know what you're getting into, and you get a good, picture of that. And then 3 letters of reference and an essay, and then students get interviewed and they get told. So usually all that's happening kind of in the spring if they want to start in the summer. And then everybody starts in the summer together. Here are those prereqs. So this is why, I said kinesiology is the one that we see the most, because it's the one where most of the prereqs, actually all the prereqs are included. So everything listed here is included in kinesiology degree, except I think physics is an elective, so you just have to make sure you pick correctly. So it's included, but it's as an elective. Health sciences is pretty close. All of this is included in health sciences except for the last two. So biomechanics and ex-phys. And I can't say this for certain, but I'm pretty sure if you talk to your advisor and you told them why you wanted to take those two, you could maybe count those as electives in health sciences as well. And that way you're not taking extra classes either. What else? Our admissions page, you guys can't obviously click on the link, but will they get these slides later?
Students who want the slides, we can email them.
Okay. Yeah, so you can get the slides and click on all of our links. Are hyperlinked, or you can just Google at UCF Athletic Training Admissions and it'll take you, where that link was going to go. So this is kind of, oh, my picture got cut off a little bit. Oh, no, it didn't. Your heads are in the way. All right, I'm going to move your heads. So this is basically what our curriculum looks like. Like I said, it's 6 semesters, straight through 2 years. The entire degree from beginning to end, if you're an in-state student, is about $27,000 total. So about 13 and change a year. And we basically theme our curriculum. So the summer that students come in, there's no clinical, so it means they're just in class on Monday and Wednesday, and we're teaching them all the basics. So we do a whole nother anatomy class, even though that was a prereq, because that's what students need the most, and it's also what students struggle with the most. They either don't remember their anatomy, or it was a long time ago, or it wasn't quite the right anatomy. We're doing mostly musculoskeletal anatomy. And so that's a foundational class that we teach that material right off the bat. Prevention of injury and foundations, and then acute care 1. And that way, all the basic stuff about how you can handle an emergency before you even go out and see a patient. All that gets done. In the fall, students are in a fairly small clinical. So I think it's actually 14 hours a week. I need to fix that on my slide, but 14 hours a week. And the theme of the fall is head, face, and spine. Because that's the center of the body, right? That everything works from the middle. So we're going to teach in eval how to examine somebody you think might have a concussion, and how do you determine if it is a concussion or not. You're going to do spinal cord injuries and all that kind of stuff. So everything in the center, you'll learn how to evaluate it, and then you'll learn how to intervene with it. So that's the other class. I teach interventions, and I'm usually about a week and a half to 2 weeks behind the evaluation teacher. And that way, when you learn how to evaluate a concussion, within 2 weeks, you're learning how you intervene in the same semester. So evaluation, intervention, and general medical is all that dermatology, ear, nose, throat, asthma, diabetes, that sort of a thing. Research 1, kind of self-explanatory, and foundations is kind of ethics and laws and that sort of a thing. So students, again, are on campus Monday and Wednesday all day for those classes, and then they're in a clinical, usually at a high school. And we do that on purpose because if you're out at a high school, you're going to see football, which means you're going to probably do 12 concussion evaluations in your time at the high school. You're going to see all of that out there because the volume is just massive in a high school of what you're going to see. And a lot of it's going to be that head face concussion stuff. If you look at the spring, you can see the theme is lower extremity. So it's going to be hip, knee, ankle, all the way down. And same thing, you're going to learn how to evaluate it. You're going to learn how to treat it in the same semester. Gen Med is the other half of all that derm, ear, nose, throat kind of a thing. And then administration and another clinical. And this is where it opens up a little bit. So the fall is typically a high school, but the spring could be UCF or Stetson or Rollins or WWE or another high school, right? So it opens up a little bit in that spring semester. For the second year, now the students are on a Tuesday, Thursday block all day. And so they're gonna learn upper extremity eval and interventions and research too. And they're doing a very short clinical at outpatient rehab. So it's basically like 3 individual days, either at outpatient rehab or in recreational sports, which would be UCF Rec and Wellness Center. The second fall, you're actually off campus. So right now, because we're in fall, our whole second year cohort is gone. They are out basically working a full-time clinical, 30 to 40 hours a week. There's been lots of conversations with them and our clin ed coordinator about what makes sense for them to do. So Milo, you probably would have been having conversations with our clin ed coordinator about wanting to be at a soccer team, right? And so they're placing you based on your professional goals, your strengths, your weaknesses, and what we need to finish up with our Katie requirements. But we generally try to finish all the required things in the first year so that the second year we can tailor the student's experience to what they want to do with their life. So they're out basically in an immersion clinical, working basically full time, and they're in one online class where all the class assignments and lessons kind of relate to the patients that they're seeing out in their clinical. And then the final semester is kind of a cleanup. I call it an acute care sandwich. You can see we have acute care 1 in the first semester and acute care 2 in the second or in the last semester. We recertify students in all of the emergency skills so that they go out the door ready to not have to deal with recertification, for 2 years. They also refresh. So like the first acute care, you're learning the skill itself. Whereas the last one, you're refreshing and everything is scenario based. So if you've ever walked by Health Sciences 1 or 2 in the spring, you might have seen a group of people out on the lawn with spine boards and trauma bags and all kinds of stuff. And that's us, students running scenarios for emergency situations. And then you have admin, you finish up your research capstone, and seminar is basically a test prep class, just 1 credit. And there's a 20-hour clinical there too. So that's basically what our curriculum looks like. Maybe I'll stop because I feel like I'm talking a lot. Are there questions so far?
We did have a question. Somebody was asking, is there a minor that would be beneficial for someone pursuing a career as an athletic trainer?
I'm not as good at minors as I used to be. When we were a bachelor's degree, students took a fitness minor, but that doesn't exist anymore. And kinesiology is now its whole thing. So I think I'd have to think on that one. And that's actually a really good question that we should probably put into some of our open houses. I think there used to be a health administration minor that was fully online. So I would say a kinesiology student who's getting all the body stuff in their major might benefit from an admin minor, especially if it's online and the schedule's, always going to work. That could be beneficial, but it doesn't make sense for a kinesiology to do like a fitness minor. And like I said, I don't think it exists anymore. I don't know. What do you think? You probably know that answer better than I do.
I think it depends on their major. If they're not
Yeah.
doing an athletic training major, then probably getting a minor that is as close as possible to the ones you were talking about, like that health
Yeah.
sciences or kinesiology.
Yeah, but yeah, so we're a graduate degree now, so most students are going to be kinesiology. I'm trying to think of minors that I've seen of students who've applied coming in. Yeah, and I don't know that I see them all that often. Pick something that you're interested in or pick something that's lucrative, marketing or admin. And I'll do some thinking about that, and maybe we need to add that to our next open house. That's a good question.
So we also have another question. Brianna's asking, are students in the AT master's program allowed to have a job?
Well, you're adults. You're allowed to do anything. So, and actually, I use that phrase a lot. We treat our students like adults. They are adults. We were never going to tell them what they can and can't do. What I can say is that most of our students do have a job. A full-time job probably is impossible. I don't think we've ever had a student do that because you see our schedules all day Monday and all day Wednesday for 3 straight semesters, and then all day Tuesday, all day Thursday. So, there's not choices of classes. Now, in some ways that helps a student who has a job because you used to have to like figure out when the heck are my classes going to be next fall. I don't know. Well, your entire schedule and it's a block and you're going to be here all day. And so if you can schedule around that, great. That it's actually an easier schedule than maybe what you're dealing with now. So it's not usually the schedule that is the problem, it's the amount of time you need outside of class to study and make sure you're ready. You're in a 12 credit graduate healthcare program. So that's an overload program. Most grad students take 9 hours, you're taking 12. It is a very streamlined schedule, but it takes a lot of outside of class work. So when I ask students who have jobs about how much is reasonable before you start losing your mind or your grades are slipping or you're having an anxiety attack, they tell me it's 12 to 15, depending on the student's level of ability to manage. You know, some students are really good at that. They can do a little bit more. If that's not your skill set, you're going to have to do less. But we tell you everywhere you need to be, and then you just need to be there. And what you do on your own time is your own stuff. So, a part-time job, very reasonable. And then a full-time job, pretty impossible.
And then going off of that, somebody else was asking, when it comes to clinicals, are there hours we have to get on our own, or are they given to us through the program?
So you're assigned the clinical site by us. You don't have to find a place to go. And then it's usually a conversation between the student and the preceptor. So like, let's take this fall semester as an example. We have first year students, they're all at a high school. Most of them have gone and had a conversation with their preceptor, and you know, the conversation is either, doesn't matter, I don't have another job, I don't have anything else to do, just tell me when you'd like me here. That's pretty rare. Most of the time it's, I have a job, I need to at least make sure I have one full day where I don't have class or clinical. Can we make that happen? You know, and the preceptor is going to say yes, but it can't be Friday because Friday night football, like you're going to miss the whole thing, right? So, you know, you can go and have a conversation about what's going to work, because we don't want students to not to pay rent. We don't want students who can't afford to, you know, feed themselves. So preceptors will have a conversation about what's going to work. And then there's some non-negotiables. You know, you can't go to a high school and say, I can never come on a Friday night in the fall. That's not going to work. But if you need, you know, if you're in class all day Monday and all day Wednesday and you need to be Tuesday completely free, they'll say, sure. I mean, it's a 14-hour clinical. You can easily do 14 hours on a Thursday and a Friday, you know, or whatever, and you'd kind of make that schedule as a conversation. Does that make sense? Once you get into other sports like UCF, Stetson, you know, high school is very predictable because everything's going to be in the afternoon. It does get a little bit messier. Like if you're a fall second year student right now and you're assigned to whatever, UCF football, they don't give you the schedule all that early, but it's also kind of predictable. They're a morning team. You're probably going to need to be free in the mornings. They don't ever practice in the afternoon, and you'll have the game schedule to know if you might be on the road or not. But other than that, like they could change things, right? And they sometimes do. So it gets a little messier certain semesters. But like I said, students just work with their preceptors to make sure that stuff can happen.
Thank you. And then it looks like Christian also had a question.
Oh.
You can go ahead.
Hello, can you hear me?
Yeah.
Okay. So my question is, how many students usually get admitted into the master's program?
Awesome. So I think, I don't know if I have that. Yeah, usually right now we're hanging out about 22. At the undergraduate level, we had 28, and that would be our complete max. We actually do not have chairs or a fire code for anything more than 28. We have found that 22 is a nice number for graduate students, and that's kind of where we've been hanging out. Now, what does that mean? Usually students want to know that because they're trying to figure out how competitive and scary the application process is, right? So it's something that you need to take seriously. Obviously, application means you want to put your best foot forward and do everything the best you can. It's not terrifying like some other health professions are. When you hear the numbers in PA and PT, it's kind of terrifying. Med school, kind of terrifying. Athletic training, and this is something that I'm actually quite proud of. We still are allowed to treat an applicant like a whole person and not a score. And so we will have anywhere between 60 and 80 applications in a year. But just like PT and PA, it's a national application system, so they're not all real. And what I mean by that is most students are applying to more than one place, right? So I might have 60 or 70 applications. I don't know if UCF is their first choice or not, right? And neither do the PT schools or the PA schools. So when you're hearing numbers like 1,000 people applying, to PA and PT. That's not real either. You know, they're applying to 6 or 7 places. So I would say we interview 45 to 50. We offer 40, 35 to 40, and then we end up with about 22. You know, so that gives you an idea. Average GPA is probably around the 3, 4-ish. But we have a wide range of GPAs. We're not requiring a GRE right now, you know, and we really are allowed to kind of treat the applicant like a full person. If you have an area that's not, you're not quite as confident about in your application, maybe there's an area where you're going to excel.
Okay. Uh, to build off of that, like what kind of sets students apart from others, like during the application process?
Um, well, so the flip side of that, even though I did just say we can teach, we can treat people as a whole person, that is absolutely true. But also we do have to be fair about how we assess people. You know,
Mhm.
so we're looking at a couple of things. One is the GPA. You get higher points for a higher GPA, you know, less points for a lower GPA, and then there's a cutoff GPA. Prereqs to be done or in progress. So if you have a C or better in your prereqs and they're all either done or in progress, you either get credit or you don't for that prereq. 50 hours needs to be either done or not done, then you're not gonna be still in the pile. So pretty much everybody's gonna have full points on the 50 hours. And then the letter is scored by the same person all the time. So I would say that's where you have the most control because I assume you're already doing as well in classes as you can, right? You're probably already trying to do well in school. The letter is something you have 2 years to write, you know, so make sure it doesn't have a typo in the first line. Make sure you've had somebody read it who's not just going to say, oh, this is great. Make sure it says something. You know, what I mean is like 2 pages of fluff is not necessary. Answer the questions that are in the application. They're pretty generic questions, you know, why athletic training and, you know, what do you want to do with your life? It doesn't take 5 pages of fluff to do that, you know, so just do it. Make sure it's clean. Have their office read it, whatever, because that's just an area where you have full and total control. And then after that interview, same thing. You have control over your interview for the most part, and you just make sure that you understand what you're getting into. We're not asking rocket science questions. We want a student who knows what they're getting into, has an idea of what they want to do with their life. Doesn't mean you have to be certain, right? This is very common that students say, well, I like this, but I also think I might like this. I'm not sure. But we don't want as a student who's got no idea and no thoughts and hasn't asked questions of their preceptors. So yeah. Did that answer the question?
Yeah, thank you.
Okay.
And then Morgan also had a question. You can
Sure.
go.
Go ahead. You guys are the best group ever. Oh, you're muted.
Oh, sorry. So I actually live in Melbourne.
Huh?
And I know you just said like, oh, you're an adult, you can do whatever you want, but is it reasonable or do you have like connections with people in the Melbourne Palm Bay area, or do you think I would have to relocate to the Orlando area?
That's a good question. It has happened. We have had students do it. It is not easy, right? And so usually what we've seen is a little bit of a hybrid. So I've seen students, so we've had students in Melbourne, Palm Bay, Cocoa, Daytona even. And that's a hike, but the traffic, at least on that side of town, is not usually the worst. And so a lot of times they'll stay home in the summer because they're only coming to campus 2 days a week and they don't have a clinical, right? And also leases, getting a summer lease is hard and you end up with some rando and it's usually not a good situation. We have some high schools on that coast that it is possible. We don't make promises, but it's possible that we could place a student out on the coast if they're at a high school in the fall. We can do it in that direction. But it is never a promise, right? Once it kind of gets past that semester, though, we do find students who thought they were going to live at home the whole time. They tend to kind of move towards campus at some point, that end of the first year to the second year, just because they're realizing that they're overwhelmed with the driving. We have had some people do it though. You know, again, you know how good you are at time management and how you can handle things. But we do see students start doing that and then change course at some point because they realize they're not managing.
And are you guys open to like the idea? I remember there was one like something like this that I had gone to where they said like a lot of the times um like you guys are like open to us finding like the place and then you guys like either approving it or not. Because like I've reached out to even like FIT and
Yeah.
some local high schools here who they have mentioned being able to work with me. So like
Yeah.
would you guys be in
So
that as well?
most of the time when a student like you is asking that question, that's because they're wanting to go somewhere super far away. And we are open to that if there's a place that wants to have you and it's a great experience and we can get the legal paperwork done. For somebody like you where it's closer like that, we probably would still just work with you on it. I mean, we already have high schools out there. We have Kennedy Space Center out there. We've got, so we probably we wouldn't even consider that non-local. We would just consider that trying to work with a student who's on that end of town. Carlos does a good job of making sure like he's never going to send somebody like you if you're living in Melbourne to West Apopka, Orlando. Like he's not going to do that, but he also can't promise you'll always be on the coast. So it's a little bit of it's always a discussion to try to make sure that things are done right. And yes, we are open to new sites if that is making more sense.
Right. And like I commute now already, so it's not like
You're used
too
to it.
too bad, but like
Yeah.
if the possibility was there, then that'd be great. But if not, like I understand as
Yeah,
well.
yeah. So, let me just blow through a couple pictures. I know we're up against the end, but also we've already done a lot of questions, so that's what the end was for.
And we just had two more questions
Oh,
whenever
okay.
you get a chance.
Go ahead.
So somebody was asking, what is the essay on? And then somebody else was asking, how do you achieve the 50 hours?
How about at the very end? Let me blow through this and then I'll take my screen to that website and that way students can just see it firsthand. So these are just some pictures, awesome pictures that I updated. So I feel like I have to at least tell you about them. These are kind of field trippy types of things that we do or students have done on their own. So we go out to a Olympic weightlifting gym to learn how to snatch, clean, and jerk, and that's the final semester. So this group was about 2 weeks from graduating when we did that. This is a student who is out working. We do a lot of physical exams for Orange County, Seminole County, Advent Health, where we had one event last year where we had 600 student athletes come through, middle school to high schoolers, and we did physicals on all of them with a bunch of doctors and PAs as well, obviously. We collaborate with the College of Nursing. This is a nurse practitioner, Dr. Blackwell. He comes in and talks to our students and shows them how to do a lot of the respiratory stuff. Nursing also teaches our students how to suture an IV. We have a group that comes from Japan every year, and they bring over students. They're called judo therapy students, so similar but different to athletic training. And they come for about 4 days and learn with our students. And then these are a bunch of students working the Pro Bowl, I guess 2 years ago. So that's the great thing about Orlando. We have a lot of really cool events come through, and then our students get asked if they want to help. This is that event where we did 600 students that day with the Be a Player organization. Our whole both cohorts go on a trip to a convention in February every year. So that's a big old pretty class picture. These are students at that convention learning how to suture. And then these are students presenting research. And I'll admit this is a staged picture because he was somebody about to graduate, and this is an alumni. And I said, act like you're talking about his poster. So we have alumni come by and say hello to us at conventions too. We've got people here at UCF who work here. So this is Aaliyah. She's an alumni of ours, and she also works for softball. I told you this is actually the same guy from Dartmouth who I showed you earlier, but we have 3 alumni at Dartmouth. So most of their athletic training staff is from UCF, which is kind of weird. This is Isis. She's at Bethune-Cookman right now, but she did an NFL internship with the Rams. I think that's the Rams. So we usually have students doing NFL internships in the summer. I told you about the 2 city soccer athletic trainers. This is them. Just last week, I took that picture on my television. We've got somebody working with the Air National Guard, and they took her up in a jet so she could feel the G forces. So that was pretty cool. Lisa here is working the parade, the Macy's Thanksgiving Day Parade, because she's in a performing arts setting, and so she was working with her show. Like, you know, they have musicals that do the parade. She was doing that. We also have had an alumni work with the varsity cheer groups that go to that parade. This is Ken. He's actually assist in surgery. He is at an orthopedic surgeon practice, and he's actually looks a lot like a PA, scrubbing it on surgery. And he runs a residency program for athletic trainers who want to know how to do that. This guy actually, I think it was Milo was asking about soccer. He's the one who was at the pro team in Spain with soccer, but then he switched to military practice. So this is him in Korea at an Air Force base working with military, and obviously the pandemic is the mask. And then Aaron Cash is a head athletic trainer at Virginia Tech. So just fun, cool pictures of our alumni. You can see they're doing a super wide variety of things. What was the question I was going to get back to was hours in the letter?
Yes, it was what is the essay on and how do you achieve the 50 hours?
All right, so let me get there. Oh, that's taking me to the main page. All right, so UCF athletic training is, I'm Googling UCF athletic training admissions just like you would, and then I will share my screen here. So this is just on our main website, and you can see here the personal statement, professional goals, including your understanding of the profession and why you've chosen athletic training as a career. And then as far as the hours, if you, instead of making everybody dizzy, if you go up here to frequently asked questions, there's a question there that says, how do I document my hours? Right. So some students did them in high school because they were an athletic training aide at their high school, and we don't say they expire. It's a great experience, so we count those. You can do them here at UCF. You can do them in athletics or rec and wellness. We have students do them in Orange County, Seminole County, or you can find your own place. So usually with that, if students want some contact information, they can use me for help. So if they say, I'd love to do it at UCF, can you tell me who I would contact? I can do that by email. I don't put their stuff online anymore because they just get too much stuff. But if you also, live in Melbourne and you want to know who you could ask in Melbourne, I usually know somebody that, you can ask. Every athletic trainer out there is going to know exactly what you're talking about because we've had to do hours since the beginning of time, and it tells you how to document them on that frequently asked questions page. Anything else?
I just had one quick last minute question.
Yeah.
Um, sorry. I saw something that you guys had a connection with Orlando City.
Yeah, we have several actually. Our students, I'm not sharing my screen anymore. I'll just talk. We have students placed with their city soccer team, but also their A team and their B team, as well as the developmental league, because they have middle school through high schools who basically live there, and they are in the pro soccer developmental camps, and they're usually online students. So we have 3 students embedded out there, one at each level. And then we also have students with the Pride. And then I mentioned the WWE, and then we also have the Solar Bears, which is professional ice hockey, and the Valkyrie, which is professional volleyball.
Okay, and when would be like the soonest, like for example, like I'm a freshman, I just started, I'm doing getting my prerequisites out of the way. When would be like the soonest that I could, let's say, at least try to get involved with them?
Well, with them would be a discussion with them. If you're just asking like when could you maybe start doing some observation hours, whenever you want, and probably the smoothest thing to do, because probably city soccer is not going to be like, sure, come on out, freshmen, no offense, they probably just won't. But UCF might, or Stetson might, or Rollins might,
Okay.
so you could get some experience at a collegiate soccer team while you're still in school. I'm not saying don't ask city soccer. They might say yes. But I'm saying if they say no, there's other ways that you could go about getting some experience. And students can do hours anytime during their undergraduate career. And I can give you contact information for different places.
That'd be great. I appreciate that.
Brianna.
Thank you. I appreciate that.
Mhm.
Hi, can you hear me?
Yeah.
Hi, I was just wondering for the fifty observation hours, would that tie into also the internship credit we would take in the kinesiology
They
program?
can. So the kinesiology, just for everybody else, it's an optional internship, right? But a lot of students do it. You can make
Yes.
the same hours that you're doing for us, the hours there. And the person who runs that internship is Sherry Norte. And she can help you with that. So we've had students do it at a bunch of different places, but they've gone out to UCF places and non-UCF places and kind of counted it for both.
Okay, great. Thank you.
Mhm.
So I see we're towards the end here. I don't know if you'd like to stay and take questions, but if
I
not,
will if we're allowed, but also
you
I
can
don't
go
want
ahead.
to hold
Yeah,
you
if
up.
you'd like to, and then or maybe if there's an email too, I could drop in the chat for students who have requests, more
Sure.
questions.
Here, I'll put my last slide up again. Ah, let me go to my last slide and it'll have everything on there. Let's try that. All right, so here's that AT info right here, and you'll get either me or Damien. And then here's my regular email. Melissa.
Hello, can you hear me?
Yep.
Okay, so my question kind of referred to like one of the beginning of the slides. It's like in working in such a wide scope of areas and practices, do you have to have like specific training for each practice or each, I don't know, because like it's like some of them are firefighters that work like 24 hours and then others are like
Yeah.
more clinical based and stuff. So I was just
Yeah, so
curious about that.
there's not many certifications that somebody has to have, according to a setting. There's a few though, like people who work in physician practice, so like with orthopedic surgeons and stuff like that, obviously they might get an orthotech certification or a casting certification, but as far as like getting the job, you come out as an athletic trainer with the basic requirements and then you can get those certifications after, or some places will even train you and have you get the certifications with them, right? So I think I mentioned Ken out in Oregon. He runs a residency program where students might come from a master's degree program as an entry-level athletic trainer, do a 1-year residency with him out in Oregon, and you come out with all the orthopedic specialty stuff. But as far as high school, college, pro, it's usually just your regular degree, and then you could certainly make yourself more marketable, by having like you guys are going to be taking CSCS or NSCA or whatever test you're going to take as part of your degree. Makes you more marketable than somebody who doesn't have it, but it's not required. There's not any certain certifications that like public safety would expect, but there might be certain trainings they would give you once you get that job.
Okay, yeah,
So
that
it's
makes
not
sense.
common that you have to have something extra, but there's a lot of things that could just make you more marketable.
Okay, and the hours of the work they vary on based on like where you
Yeah, and so
are.
that's where,
Correct.
depending on what somebody's temperament is to that line that I said, different day, different thing every day, that might be fun while you're young. Might not be as fun when you're kind of tired of being on the road all the time, but you can work in a 9 to 5 setting as an athletic trainer. You can work in a high school setting where it's going to be all afternoons and no holidays or weekends. You can work in a college where it's literally all over the place, and you can change places depending on what, your temperament is at the time.
Okay, that's great. And the civilian contracts
Those are
were
usually 9 to 5.
those
Military
okay.
practice is typically 9 to 5, set schedule. But it's like a hybrid. It's a team. It looks like a team. You've got your recruits or whoever it is that you're working with, and they have a set schedule, but it's kind of like you're going out to practice when it's really their training. But then you might have appointments in the afternoon for people who are hurt, and it's a 9 to 5 schedule. So that's kind of the best of both worlds, frankly, because they pay well. You have all the excitement of being with a really high level athlete who's doing a really important job, but you still get to go home at 5. So it's kind of a really great gig, honestly.
Right. Thank you so much. Appreciate your time.
All right, and then I think there was just one more question, which was, could you take referee hours as part of the 50 hours?
No, unfortunately, we can't. We want to make sure you understand athletic trainer, but being a referee might help you get connected with somebody who would let you do that. But you have to be with an athletic trainer, somebody who's certified in a high school, college, or pro setting.
Also, it looks like I don't have access to the slides. Would it be all right if students email that email for the slides, or you could send them to me and I could relay them?
Either way, I'll send them to you so you have them, and they can either email you or me.
Okay, great. Thank
Thanks,
you so much,
everybody. You guys were
Christy.
awesome. I was afraid I'd be talking to myself.
It was wonderful to have you here, and thank you so much for staying and giving all of our students this information. We really appreciate you.
Thanks for the opportunity. Bye, all.